Can you take a Flintstones complete multivitamin and be done with it? Are there really must have vitamins and minerals you need after bariatric surgery? Can they all be taken together? Or is that a mistake if you want them to work? The right supplementation is so important to your success. Don't go anywhere. Let's talk about what vitamins and minerals you really need and how to take them correctly.
Do you know what's in your vitamins? ProCare Health does. Made in the USA, it's certified facilities. Each batch is independently lab tested to ensure purity and potency. Why settle for less when you can have the most affordable, high-quality vitamins delivered to your door? Visit ProCareNow.com. Use code BSS10 to save 10%.
I'm bariatric dietitian Dr. Susan Mitchell. You're listening to the Bariatric Surgery Success podcast. I'm so glad you're here today. It matters where you get your nutrition information. When it comes to bariatric surgery and also the use of GLP-1s, nutrition is specific. Well, you're in the right place, friend. Let's get started. Vitamin and mineral supplements are a lifelong part of your bariatric lifestyle. So let me say that again. Come in close. When you have bariatric surgery, vitamin and mineral supplements are one of those items that will be on your daily to-do list from now on. Lifestyle change or a tweak to your daily routine, supplements are a top shelf strategy for your ongoing success. Now, you may be saying to me, no one really made it clear about all of these supplements that I need to take. Well, nutritional deficiencies are common after bariatric surgery, and the type of surgery performed does make a difference. Vitamin and mineral deficiencies are more common after procedures like Roux-en-Y gastric bypass or biliopancreatic diversion as compared to a sleeve gastrectomy and adjustable gastric banding. That's why you always hear me say, check back with your dietitian for clarity if you're unsure about which supplements are needed for your procedure. And recommendations do vary, and it can be frustrating, I know, between surgical centers and even professional groups. So don't be surprised if your supplement suggestions are different from someone else you know who's had surgery. Now, before we get into specific vitamins and minerals, I want you to keep in mind these three important tips. Number one, if you did not start on supplements before your surgery, then you will typically start when you go home from the hospital, which is usually 2 to 4 days after surgery. So if you've had surgery and you're at home now, you should have started on supplements. Number two, your body may have changed in its ability to absorb vitamins and minerals. How much it changed depends on the surgical procedure. When selecting your bariatric supplements, chewable or suckable pills or liquids may be a really good idea the first 1 to 3 months. So ask your dietitian for guidance, as they usually have a protocol. And then you can switch to capsules or tablets. Number three, routine vitamin and mineral screenings or lab tests should be part of your care from your healthcare team. How often and what they screen for will vary with your procedure. A lot has changed in the vitamin mineral world, and it continues to change. In the not too distant past, bariatric specific supplements weren't as common, so we combined various over-the-counter products to get what you needed. I was asking Gail Smith, the bariatric dietitian at the Weight Loss and Bariatric Surgery Institute in Orlando, Florida, what she does. Now, by the way, their website, if you want to find out more, is orlandohealth.com/bariatrics. You know Gail as one of your favorite bariatric dietitians who regularly joins me on the podcast. She said she goes by the ASMBS, or American Society for Metabolic and Bariatric Surgery recommended supplement guidelines, which are based on a current review of research for key vitamins and minerals needed after surgery. In fact, Gail says that many of the bariatric supplement companies follow these guidelines in making their products. That's why some bariatric vitamins are better and easier to take, because everything, or almost everything you need, is in 1 or 2 supplements per day. A big improvement over what we used to have. Many companies provide a wide variety of bariatric products. There's so many to choose from that it's easy to become overwhelmed about which ones to buy and take. So you'll need to do some label sleuthing, and I'm going to show you how. So let's dig into the general suggestions for bariatric surgery, knowing that your healthcare team may tweak these. Today, in part one, we'll talk about multivitamin and mineral supplements along with vitamin B12. In part two, we'll cover iron, calcium, vitamin D, and thiamine. First on the list, take a complete multivitamin and mineral supplement that is bariatric specific. One more time, this is a core concept. Take a complete multivitamin plus mineral supplement that is made for bariatric surgery. Okay, so what the heck does complete mean? Complete means it contains the typical A to Z formulation of vitamins and minerals, similar to what you find in an adult supplement, but in amounts specific to bariatric surgery. Make sure it includes both vitamins and minerals, and check for vitamins A, D, E, K, folic acid, and thiamine, along with the minerals iron, zinc, selenium, and copper. If it's a good quality bariatric supplement, it will contain all of these and more. Now, don't miss this. You can find a multi both with and without iron. And it's fine to take your iron in the multi, and there are multis that contain different amounts of iron. You want to be sure that you get the amount of iron recommended for you. Also, the number of multi capsules or tablets that you take every day will vary based on the brand and what they contain. Typically, the dose will be 1 or 2 tablets, capsules, or chewables per day. But how do you know? Label sleuth time. Do you have a vitamin container near you? Go get one, would you? Let's look at this together. Now, take a look at the supplement facts label, which you'll find on the back, or it could be on the side, depends on what the product looks like, of almost all supplements. I say almost all because the supplement facts label is what you'll find in the US. And I realize that if you're listening from another country, you'll have a different label. At the top of the label, you'll see the serving size, such as 1 chewable tablet. Then you'll see each vitamin and mineral along with the amount per serving and the percent daily value. And percent daily value, or DV, is the percentage that chewable tablet provides of your daily needs for each of the vitamins and minerals listed. You'll want to see 100 to 200% daily value for most every vitamin and mineral, but there will likely be a few that are higher, such as thiamine, B12, or even iron. If your multi contains iron, which it usually does, be sure and take your calcium separately. Wait about 2 hours or more from the time you take the multi, or the calcium will not be absorbed well by your body. Remember to sign up for my weekly newsletter called Breaking Down Nutrition. It's a quick way to keep up on nutrition for your bariatric lifestyle. You'll be the first to know about helpful nutrition tips and recipes, giveaways, product specials, and the latest podcast and upcoming interviews that you don't want to miss. Sign up today on my website, breakingdownnutrition.com. Next up, vitamin B12, also known as cobalamin. You need somewhere in the range of 250 to 1,000 micrograms every day. Now, this dose depends on your surgery, your lab results, and the route of administration. That means, is it under your tongue? Are you swallowing it? Are you chewing it? Sometimes an intramuscular injection of B12 or a nasal spray will be ordered by your healthcare team. Now, the good news here is you can take B12 at any time or with any other supplements. It's likely, though, that your multi will have enough B12 in it. So check the label before you buy additional against what your healthcare team has told you to take. Be sure and discuss those lab screenings with your dietitian before you decide to take any extra, because more is not always better. The absorption of B12 by your body can be affected by bariatric surgery due to changes in acid production and reduced availability of what's called the intrinsic factor. Well, this intrinsic factor helps the B12 to be absorbed and used by the body. When it's not there or it's insufficient, B12 doesn't get absorbed and used as it should. Well, you could experience neurological symptoms, which include numbness, tingling of your arms and your legs and your skin, plus feel like your coordination is off. This is a prime reason why routine screenings are so important and typically done every 6 months or so. These screenings help your healthcare provider pick up on a possible deficiency, hopefully before it becomes a problem. So here's what I want you to do this week. If you're multitasking, come back to me and listen closely. This is so important for your long-term success. Take a minute. Look at your multi and your B12 if you take it separately. Make sure you're on track. Are you getting what was recommended for you? Ask your bariatric dietitian if you have any questions about your specific needs, because you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell, or Practicalories, LLC.